U.S. President Joe Biden said last week that he backs negotiations for a vaccine patent waiver. A number of other world leaders support him. So does the director of the World Trade Organization. But is it all it's cracked up to be? We're joined this morning by Dr. Harry G. Broadman, Chair in Emerging Markets, Berkeley Research Group. Good morning.
Good morning.
What do you think about the idea of an intellectual property patent waiver for COVID-19 vaccinations?
It really depends on what the goal is. If the goal is to boost supply to countries who are in need of supplies of the vaccine now, it's not clear what a waiver for protection of intellectual property will do that is relevant for this time period. It will take a long time to go through the negotiations at the WTO, and even if the waiver is granted and approved by the 164 members of the WTO, which has to be on a consensus basis. In other words, if one party says, I'm not in it, it's not going to go anywhere. Even then, whether that translates into factories in different locales in the U.S., for instance, to produce vaccines, that's many months away. So it's quite perplexing, I think, for trade specialists like me and also specialists in emerging markets like me to understand what the objective here is. There must be some other objective that I'm not keyed in on behind the U.S. move.
What could that be?
I really don't know.
We hear about it. It's about equity. It's ensuring that low-income nations can get access to adequate supply of vaccines, that as long as the developed world is left out of mass vaccinations, COVID-19 and its many variants will continue circling the world and putting everybody at risk. What do you think about that?
Well, that's certainly the case. If we were talking about attaining global herd immunity, then it's in everyone's interest, including the U.S., to make sure that 80%, whatever the magic number is of the world population, is inoculated and has the vaccines in their arms. But if that really is the goal, and I'm sure, or an aspiration, and I certainly support that, and I'm sure that that's what Washington wants, why not have the U.S. government purchase supplies of vaccines made by the pharma companies and distribute those vaccines via planes to India, to other countries who are in dire need of these things. So if there's a broader agenda, to answer your question about relaxing protection of intellectual property, that's going to be a huge fight, because any economist, I think, worth his or her own salt will tell you that diminishing incentives to get paybacks on research and development expenses, that's not going to create, the kind of industry that we want the world over. Now, whether it's a question of whether or not the prices that are charged for drugs, vaccines in this particular matter, and they've at least in the United States, they've been paid for by the government, that's a different matter. If you're worried about the price of medical products that have been the result of research and development, as they always are, by drug companies, that's a different battle, that's a different issue than waiving intellectual property rights for production purposes.
It seemed to me when it comes to global vaccine equity and making sure that, say, emerging markets, the developed world, low-income nations had access to vaccines, that was the raison d'etre of Gavi, of the COVAX system, right?
Correct.
Yeah.
Correct.
Yeah. So this would seem to be maybe an admission that maybe COVAX isn't working out. I don't know, Dr. Broadman. So,
well, it may well not be working out. I don't follow that on a daily basis. But then individual countries like the U.S. can take it upon themselves, as I say, to load up a plane with vaccines produced by Pfizer or Moderna. You pick your supplier and fly them to countries in need of get the vaccines in their arms now. Every day that goes by without a vaccine in an arm is a risk, not just to that country, but as you say, and we've talked about just a moment ago, to the global community in terms of retarding getting herd immunity.
Why is patent protection important in the pharmaceutical industry?
Well, as I said, research and development in any industry, but in particular in the pharmaceutical industry, is a long period of investment, of trials, and human interaction in making these vaccines that cost a lot of money. And in order to create an incentive for companies to recoup the monies that they have spent on research and development, you want to give them some period of time when what they are producing cannot be replicated for free. That's just sort of economics 101. So I think that's the basic incentive question, and I think most people understand that. I think where there is the rub is that when you provide patent protection for 20 years, 15 years, pick your number of years, the allegation then becomes, well, what are the prices that are charged once your patent is protected? If you are the sole producer of a particular item, or one of a few producers of particular items, and there are therefore by definition no competitors, then the question becomes, well, how long should we allow those kinds of protections to stay in place in order for the companies to recoup their investment? That's an age-old debate.
Right.
And, we're not going to settle that, I think, with this vaccine issue.
No. Okay. I guess, one of the things that I look at is variants are so top of mind for a lot of people that what if there is some global variant that comes along and it is vaccine resistant, and it's back to the drawing board for a company like Pfizer or Moderna. Maybe its quote-unquote secret formula has kind of a head start on everybody else. Where's the incentive for those companies to innovate, to tackle the next global health concern if with the stroke of a pen the American president can remove patent protection? That's, I guess.
Well, I think,
right?
I think that's exactly sort of, the apprehension, including by people like me who worries about getting the incentives right, so to speak.
Yeah.
And whether or not, Pfizer and Moderna now have a head start, which presumably they do, in manufacturing a second generation of the vaccine. But, who else can enter the market to do that? I mean, we would all love another supplier to come into the market. But at this point, they've invested a lot of money, rightly or wrongly, and so they do have a head start. And I'm sure, I'm not a medical doctor, I'm just an economist doctor,
okay.
But I'm sure people are very keen in figuring out, what will the next variant, what could the next variant look like? And what will that mean in terms of modifying, the incumbent vaccines?
Do you think the argument, let's take Moderna, for example. Before COVID-19, Moderna had never had a single therapy ever approved by the FDA, ever. The U.S. government invested $1 billion into Moderna to help get it across the finish line with the FDA with its COVID vaccine. Do you think because a company like Moderna took $1 billion worth of government money that its position on patent protection would be weakened? You'd be nowhere without the government to begin with, Moderna, for example. What do you think?
Well, presumably,
yeah.
Presumably, and I don't know whether or not Moderna tried to get other private investors to come in, but only sought money and was able to get money from the U.S. government. But then you're raising the issue, which is important, of the public good aspect, in an economic sense, public good aspect of the problem, and that's why I say if the U.S. government showed interest in helping Moderna create their vaccine, it could be just as easy for the U.S. government now to say, you know what, we're going to buy, we're the U.S. government, we're now going to procure from you, Moderna, and maybe we'll do it at a discounted price. I don't know. But we're doing that because we now want to distribute your supplies outside the United States to countries that cannot get access to these vaccines. And so, the issue is, where there's a mixed message, is what's the real intent now? If the real intent now is we've got a global crisis in this disease, we want to get herd immunity, we need to get vaccines in arms, rejiggering the patent protection issue is not going to engender any kind of supply response in the relevant period. If we want to have a larger debate about whether or not patent protection should be for X number of years, or when a government helps a private company through a public-private partnership, those are really important questions. Then let's have a fulsome debate about that. And I don't know the answer to it. It's a tricky question, lots of trade-offs.
Yeah.
But then let's be forthright about what the discussion's about. Not, we really need to help the Indians and the South Africans and other countries in need of getting vaccines in their arms.
Yeah, I wonder if this is really a magic bullet for supply as well, and whether the manufacturing capacity really does exist the way some people might think it would, and whether generics are just going to start rolling out of generic manufacturing facilities. I mean, Pfizer, Moderna, Johnson & Johnson, AstraZeneca, some of the, at least maybe with the exception of Moderna, these are some of the biggest of big pharma. I mean, if they're tied in, they've been tied into these supply chains for more than a year now. If they can't do it, really, who can? I guess that would be one of my thoughts as well.
Right, and I think that's probably an accurate statement. So, but then in the name of public policy and public health, whether it's the U.S. government, whether it's the United Nations, whether it's Bill Gates, pick whoever your supplier is to ramp up supply. Let's tackle that now.
Right. Okay.
Right.
Yeah.
That's the issue. It seems to me.
Excellent. Thank you for your time this morning. Greatly appreciate it. Yep. Dr. Harry G. Broadman, Chair, Emerging Markets, Berkeley Research Group.